Good morning, everyone. So, myself, Dr. Sachin Bongale, Associate Professor at SSIMS, Consultant Physician at Bongale Healthcare, Haryana, and also a diabetologist. So, good morning, everyone. And coming to the today's topic, so I'll be just briefing about understanding hypertension. So, we know that hypertension is the most common and like we see it in our daily routine practices. And most of the patients all over the world are suffering from hypertension. And also we know that hypertension is one of the leading risk factor which has a uh, risk over cardiovascular diseases and also over renal diseases. So as routine this thing, hypertension is one of the important topic which has to be discussed. And in today's topic, I'll be just briefing about what is hypertension, what is normal blood pressure, and how to go ahead for what are the dietary management. So how to go ahead with the physical activities and what are the management in the treatment of hypertension. So coming to today's topic discussion, it will be on high pressure and how to prevent. So generally, everyone know that everyone has a blood pressure, normal blood pressure of 120/80. So when this pressure starts to increase and it has different risk factor over the organs of our body. So basically, each time, like when our heart beats, heart pumps. So the blood which circulates against the blood walls that will cause us the blood pressure. So it is a normal blood pressure which can be seen in our every human being. So when this pressure increases, so then we will call it as a hypertension. So normally the pressure will rise and falls throughout the day, but the pressure has to be remained throughout the day, and it should maintain as it is required for our daily pumping activities. So high pressure also develops over the time. So it's because of our unhealthy choices of the lifestyles, physical activity, life stress, and lack of exercises and other consuming habits, and also our familial history. So these are the contributing factors for our hypertension. So coming to the risk factors of hypertension, we know that age is one of the important risk factor. So as the age patient grows older, the blood vessels becomes narrowing, and once the narrowing and it becomes stiffening of the blood vessels. So this stiffening causes the one of the important leading factor for hypertension. Second history is the family. So family history is one of the important thing. If the brothers, elder siblings, or even if the parents who are have an early history of ischemic heart disease, the siblings or the uh, generations of the patients can have a risk of hypertension. And the third important thing is excessive salt intake. So excessive salt intake is one of the other important leading factor for hypertension. And not eating enough food with potassium. So our dietary food consumes different electrolytes. So if potassium intake is less in our daily routine intake, so it is the other important risk factor for hypertension. And eating processed and fatty foods. So we know that in our like however routine this thing, so we eat more of junk foods. So more of these junk foods contains the risk factor for hypertension, and also the has an increased risk of atherosclerosis. And the last most important factor is stress. So we know that every human being is now at stress. Among all these mentioned conditions, stress is one of the important factor in the developing of hypertension. So every man is running now. So because of the work, familial, financial, social, all these are the important risk factors as a causing for hypertension. So as a hypertension, we know that what are the symptoms of hypertension. So when to diagnose a patient with hypertension, any patient with hypertension may come suddenly. There may be the patient symptoms may be unmasked. Sometimes patient comes to our hospital with a history of giddiness, headache, blackouts, sweating, some sort of uneasiness. So these are the things which will the patient will come to our daily routine active to our hospital. So that's why hypertension is called as a silent killer. So it is very important for us to monitor the blood pressure of each and every patient in order to prevent the risk of risk factors associated with hypertension. So fortunately, blood pressure can be easily diagnosed. We know that a simple fixed sphygmomanometer is required to monitor the blood pressure, and every blood pressure has to be monitored twice a day in the initially. So sometimes this blood pressure can be seen because of anxiety, and sometimes the patient may land up to our hospitals or clinic with stress. So sometimes this blood pressure can be elevated. So in one this thing we can't reading, we can't take the patient as a hypertension. So in this the subsequent monitoring of the blood pressure is required. And after like monitoring of the blood pressure with two different readings, and even if the pressure is more than 140/90, then we can consider the patient as a hypertensive and start the treatment. So generally the symptoms like occur in the morning, and the changes like already mentioned, the history of fatigue and vomiting can be seen. So the third most important thing is like stages of hypertension can be classified as a normal blood pressure, and also can be like pre-hypertensive, and stage 1 and stage 2 hypertension. So if pre-hypertension, if the blood pressure is like more than 120 to 139, and the systolic blood pressure of 80 to 89. So stage 1 hypertension is of blood pressure 140 to 159, and diastolic blood pressure of 80 to 90 to 99. And stage 2 hypertension is nothing but if blood pressure cross anything more than 160/100. So these are the stages of hypertension. Again, there are different classes of hypertension like white coat hypertension, hypertensive urgency, and hypertensive emergency. So these are the different things in which we need to concentrate. So coming to this thing, once we diagnose a patient with hypertension, the second thing is we need to start the treatment. So before treatment, what are the things we need to monitor? So first thing is investigations. What are the investigations we do when a patient is diagnosed with hypertension? So coming with the first, we can go for complete blood picture, going for urea, creatinine, fasting lipid profile, thyroid profile, and a basic ECG has to be done in order to look for the changes already the patient is developed the changes of hypertension or not. And later we can monitor the other routine like thyroid function test, and other this thing has to be monitored. So coming to this first thing in the management, the first thing in the management is the prevention of the risk factors. So and reversible risk factors can be modified, and also irreversible risk factors has to be monitored. The first most important thing is coming to the treatment is regular exercises, healthy diet, and the smoking has to be quit, to be cut off. And the stress is one of the important thing in the management of hypertension, and adherence to medicine. So coming to the daily regular exercises. So what are the exercises? So brisk walking is more than enough. At a minimum period of 20 minutes, brisk walking has to be done. Nearly around 150 minutes of brisk walking has to be done in our routine exercises, and also simple regular exercises can be done at our home. And the second thing is maintaining the healthy diet. So diet is one of the important things. Eating less saturated food, and also about the total fat has to be cut off, getting plenty of potassium, and limiting the amount of sodium in the diet, and reducing the salt to less than 6 grams per day. And the third more important thing is DASH therapy. DASH is nothing but dietary approaches to stop hypertension. So there are distinct whole grains, fruits, vegetables, and low salt diet products are available. So along with this, we can cut off the fat, and this is one of the important approach to reduce hypertension. And the next most important thing is reduce sodium in the diet. So reduction of the sodium in our daily dietary intake reduces the blood pressure of systolic to less than 5 to 6 mm of Hg. Coming to the most important thing is going for the eat fewer processed foods. So one of mostly important thing is which we consume, which has a small quantity of sodium, that is more important. And don't add additional salt. So we know we have a habit of additional salt over daily food this thing, so that the extra salt, addition of the extra salt has to be avoided. And quitting of smoking. So the smoking has other risk factors which leads to the atherosclerosis, and also helps in the stiffening of the blood vessels, has to be quit. And the quitting of alcohol is the other important thing. So which this alcohol enhances our fast cholesterol levels, which is the other most risk factor for atherosclerosis. So the fifth most important thing is stress management. So we already told that stress, every patient is, or every human being is overburdened with physical, and more than that, mental stress is the other thing which has to be monitored. And last most thing is adherence to the medicine. So once the patient is diagnosed and already all the investigations workup is done, it start with the adherence to the medicine. So depending on the patient's requirement, whether the patient is having ischemic heart disease, whether the patient is having renal diseases, whether the patient is having other associated cardiovascular diseases or eye changes like hypertensive retinopathy, depending on the patient condition, whether the patient is diabetic or non-diabetic, or the patient's diabetic is well controlled. Depending on this, we can add ACE inhibitors or ARBs, or if the associated heart diseases are there, so other antihypertensive can be added. So once there is antihypertensive are added, so the monitoring of the regular physical activities and the dietary changes has to be monitored. So in this, so we can reduce the blood pressure and we can bring back to the normal blood pressure. So once the blood pressure is normal, and the targeted blood pressure has to be achieved to less than 140 by 80 on the when the patient is on oral antihypertensive medications, this has to be monitored, and the patient has to follow up to their doctors or the family physicians in order to monitor their blood pressure. So house monitoring of the blood pressure can be done, and also the ambulatory blood pressure monitoring, a 24-hour BP monitoring also can be done in nowadays, which is easily available. And the BP monitoring at home, self-monitoring of BP can also be done at home, which is easy for the patients to monitor their blood pressure, and even any variations in the blood pressure, the patient can consult their physicians in order to monitor their blood pressure. So this is how I already discussed, like what are the causes for the blood pressure, what is the normal blood pressure, what are the investigations has to be monitored, and what are the treatment has to be taken once the patient is diagnosed, and the frequently checkups has to be consulted with their physicians to monitor the blood pressure and to avoid the risk factors associated with blood pressure. So this is a hypertension, how it goes and how it has to be monitored and how it has to be diagnosed. And in the way, this helps us to, as a simple discussion, helps a common people to understand what is hypertension and also when to approach their doctors. That is the most important thing. And in this way, we can prevent the risk factors or the complications associated with hypertension. So thank you very much.